out today looked at children with mild symptoms and found that 25% of them actually had COVID-19. So here to talk it through with us is Dr. Kristen Moffitt in the Division of Infectious Diseases at Boston Children's Hospital. Good to see you.
Good to see you too.
So in this study, the level of virus in these kids' airways was high, even higher than what's found in some adults, meaning they could easily spread the virus. What is your reaction to these findings, and what does it tell us about the possibility of cases if school does conduct in-person classes?
Yeah, I think it's a helpful study in a number of ways. Most importantly, as you said, these were children with symptoms, the majority of which were fever and cough. But a lot of these children who turned out to be COVID positive had less specific symptoms as well, including a sore throat and a runny nose. So this really speaks to the critical importance of anyone with symptoms staying home and isolating until they can get an evaluation with their doctor and ideally testing as well. As for the high viral loads, we know that the viral load is highest when the symptoms start and in the couple of days, both before and after that. And it's a bit hard from this study to conclude that children had higher viral loads than adults, because the adults that children were compared to had over a week of symptoms, and we know that viral loads are dropping dramatically by then. But taken together, I think this study further supports the fact that no one, including children, is immune to this infection. So it's important that people of all ages be following the recommended risk mitigation practices, especially in settings like schools and classrooms.
No, it's a good point. And talking about schools, the state announcing that rapid response team today. So this would go to schools to test larger number of students and staff if cases begin appearing. Do you think there should be a wider surveillance program that includes regular testing? Like, should parents consider trying to get their kid tested maybe every couple of weeks?
Yeah, I think that testing in a fairly systematic way that could be done with very regular frequency when or if community transmission seems to be on the rise could certainly be a very effective measure to control transmission, but it would really rely on the availability of tests that are relatively inexpensive and that can be run with a very regular frequency and a very rapid turnaround time. And we're just not quite there yet. Yeah. So I think that second option of testing every couple of weeks, especially if rates in the community remain relatively well controlled, that's less likely to be very effective since it really only captures a snapshot in time. And what you'd really want to be able to do is to follow people relatively regularly.
Right, good point. All right, so finally I want to ask you about a bit of a controversy over the state's new requirement that nearly all students get vaccinated for the flu this year. Can you talk about why this is an important step? Is it about the flu or more about COVID-19 or about the convergence of the two? Why does it matter?
Yeah, it's another big knowledge gap that we have, frankly, is what happens if people are co-infected with SARS-CoV-2 or COVID-19 and influenza at the same time. We just don't have a lot of data there yet, but there's certainly reason to believe that having both of those infections at the same time could be associated with much more severe symptomatology. So that's one reason to get a flu shot this year. And the other is to limit influenza infections as much as possible, given that it's truly impossible to distinguish based on symptoms alone whether someone has COVID-19 or has the flu. So any symptomatic individual could trigger broad closures, whether it be in a classroom or other settings, while that individual undergoes evaluation and testing. So having as much of the population vaccinated against the flu could certainly help in that setting as well. And then finally, we know that flu vaccines reduce the severity of flu infections. So with the goal of keeping our hospitals from reaching surge capacities during our winter respiratory viral season, flu vaccines would be strongly recommended.
Okay, all important points. Dr. Moffitt, thank you for your time. As always, we appreciate it.
Yeah, thanks for having me.